Bismillahir Rahmanir Rahim. My name is Dr. Tawakar. I am ophthalmology senior resident in Nishter Medical University. Uh, Today we will have a discussion regarding house officers. House officer in my career, which was 4 year, I have found 16 batches of house officer. In every 3 months, they are changing. So this will be for the house officer, and when they are coming for rotation for 3 months. So we have a certain rules, regulation, and policies of our department, and we are explaining to them. And if we explain to them, so there is a less chance of mistakes. So this is our responsibility every time. The senior PGR who is in our department, they are explaining for that to every batches. So it avoid mistakes and also increase in patient care. So this is for house officer of our department. So first of all, welcome to ophthalmology department. So inshallah you will enjoy. Ophthalmology is a wonderful field. Inshallah uh, we will have a great journey, and we will increase the inpatient care through our services. So this is a vision of our respected Sir Professor Rashid Kamar Rao Saab. He is the head of ophthalmology department, Nishtar Medical University, and also he is a principal of Nishtar Medical College, and he has a lot of multiple responsibilities. Like he is a director of Department of Medical Education in Nishtar Medical University, and also he is examiner of CPSP, and also responsible for all Nishtar Medical University PGR, and also regional examination examiner examination of the CPSP. So he is a great leader, and also he is very kind to all of his students, especially PGRs, and he is more caring for that. That is mentally and also academically. So after welcoming to all house officers, so in the next day after joining, they will have a meet with our respected sir Professor Rashid Kamar Rao Saab, and we will explain these all rules regulation to them. On the next day, they will have a duty in the OPD. Like this is a morning picture of OPD, and you have to be present there at 8 o'clock. So this is our most important. If you have duty in the OPD, you have to be present there, or if you have duty in the OT, you have to be present there. So all our senior, especially our professor, our HOD, he is coming at 7:55, and he is expecting from all senior engineer that they have to follow him, and this is the most good and habit of our department. So we are expecting also from our house officer, and that they have to respect this discipline. So if you have a duty in OT or operating rooms, so this is the you have to be present there, because all doctors, including seniors, they are coming before 8 o'clock or around 8 o'clock, and especially we are advising for the house officer that they have to come, and also PGR at 7:50, and when they are changing their scrub. One of the important thing in OT is that always they have to change their scrub in OT. If they are using clogs, that should be also they have a separate clogs for OT. And we have a special changing area for male house officer, PGR, and consultant, and also a special area for female, and they have to change in that particular area. This is also our OT, and we are taking this morning picture and we are uploading to our specific uh, group, and we have to ensure that we are on the duty place. So that was OPD, and if you have a duty in OT, or maybe you have a duty in ward. In ward, you have to also be there at 8 o'clock. It is must, because there is a lot of patient. We have about 60 beds. So in the morning, what is the responsibility of a house officer and what we expect from them? That first of all, they have to remove the iPad and clean the eye and do the dressing of the eye, and then take the visual acuity with Snellen chart. Actually, this house officer, he is the assistant of PGR, postgraduate resident. So if he has done this work, the remaining work will be done by PGR, which is the examination of the patient. And after that, we are have a round at about 9 o'clock, and we have to prepare the round. And the senior will come, and what they have decided, we have a round register. According to that, if the senior has advised continuous same treatment, CST, or if they have decided that they have to discharge the patient according to that particular medication which has been advised by senior or PGR, and they have to make a discharge certificate of that particular patient. What I have learned in my 4 years in our department, we have two values. Every organization, they have their values. If you follow that values, so you will have a very great life there, and you will improve. And these are the red lines of our department. Also, one of the basic value is that be respectful to your seniors, juniors, and patients, and also patient attendant. This is the basic value. Because I have seen in my 4 year careers more house officer or PGR who are respectful to the senior, juniors, and patients. They have improved very well. And we have one kahawat in Urdu also, that ba adab ba nasib, be adab be nasib. So be respectful, and respect is not like that uh, you will ask from someone and you will expect from someone. Respect is first you have to give respect, and that will reflect to you. The next one is discipline and punctuality. It means that I have explained previously that you have to be present there at 7:55 or 8 o'clock. Discipline is must, because our professors, he is giving an analogy. For example, he is saying that if you have a flight to another country at 8 o'clock, if you reach to airport at 8:05, just you are late 5 minutes, what will occur? That particular plane will take off and you will cancel your journey. So it is just like that. So discipline and punctuality is so important in our department, and you have to follow that. If you have this two basic value, be respectful, if you have punctuality, so the remaining knowledge, if you are weak in knowledge, inshallah, if you follow these two values, inshallah, you will gain the knowledge also. And I have seen many house officer and PGR when they have followed this two basic values, and they have gained also the knowledge. This is a ranking system of our department, which is also called organogram, which start from professor, then or HOD, and under that is professor, then associate professor, that is assistant professor, SR, and also PMO and admin registrar, MOs. And after that we have PGR and head nurse, and then the particular, and the fourth row is house officer. So in every batch we have different house officer, especially that is about 6 house officers or 6 or 7 for every 3 months, which we are dividing on 2 batches. And after that we have charge nurse, computer operator, ward aya, ward cleaner, and ward boy. This is a system. In this system every person has their specific duties, or if everyone of this organization follow these their particular jobs or their particular assignment, so the system will run and there will be no problem in that system. So everyone should know their name and their responsibilities and their authority. And also it's important that you have to know that this doctor or this person is in which rank, because if you are going to any military camp, they have also a rank system. In every organization they have a system, so you have to be careful regarding that also. So vision is so important. Why we should have a vision? If you don't have a vision in any particular organization, it is just like an envelope which is not have any kind of address. And so where we can send that envelope? We cannot send to anywhere. So vision is so important in any organization. So the vision statement of our organization is that we will develop and promote professional leadership, excellence in medical education, healthcare, humanity at the national and international level. That is the very broad vision. If you work on this vision, so you will have a good professional knowledge, and also you will have leadership, you will have in medical education, healthcare at the national international level. So this is a very broad vision, and we have to achieve. And the recommendation from our senior is that everyone should learn, remember this vision, and they have to revise with yourselves, and they can focus very well. And also we have a mission. What is the mission of our department? We are training and producing health professional which is equipped with passion, proficiency, and empathy. This is so important. So we have to be focused every day on these things, that what is the mission of our department or our organization. We are training and producing health professional which have a passion, proficiency, and empathy by achieving excellence in health professional education. It means that you should have a very good health professional knowledge, and also you should have a passion to your field, and also you should have empathy, because we have um, one statement in our ophthalmology also, that when you are meeting before eye, you have to meet the brain of the patient. It means that if you have a good knowledge, if you have a good care to the patient, but you should have the empathy with the patient and attendant also. And also we should provide for the standardized patient care and dedicated academic research. It means that we should give to the patient high quality health care, and also we have to produce more knowledge like academic research. I remember during my medical college, one of our microbiology teacher, he said that okay, someone has written this book, they have done very good work for us, but in the future who will do this, who will write the books? So someone should be there. So these are the universities that they are producing the knowledge, and we have to also focus on that. So if we know these two, one, two things like mission and vision and mission, and we remember these sentence and again we repeat that, so then we can focus on these things. And this is so important, that we should have in any particular, in any organization, we they have their vision and mission statement also, and this is the vision and mission of our department or our institute. So we have a Monday and Friday mandatory presentation on topic by the residents or sometimes by seniors. Each house officer should be present here and they should participate. Why? Because we are not just giving a knowledge there, but during this presentations or this session, we are also explaining our senior. They are sharing their experiences which they have acquired in their academic life. All of our senior they are present in that, and that are started at 8 o'clock in the morning, and they are explaining the policies, rules and regulation of our department and how to increase and patient care of the patients. So it is not like this that house officer will say it is a high level of discussion and we are not coming. So they have to be present, they are must. And also we are giving opportunity to house officer that they will have also a presentation, which inshallah I will explain you later how they are presenting and in which days. So if you have pre-operative day, for example, you have a war day, what we are expecting from a house officer? We are expecting these most important things from house officer. Number one, we have, if the patient is admitting to ophthalmology department for operation, so first of all, they should have their national identity card, and they have to register their self in the counter. After that, they are bringing their all these papers, and the chart will be made by nurse, and then they will give the chart to house officer. What is the responsibility of house officer here? Because we are this presentation is regarding that. The responsibility of house officer is that they have to register that particular patient. We have a register there, and also after that they will have he or she will take a history from the patient and also a consent from the patient that that particular patient they have to obey all rules regulation of our hospital or department. And after that, if the patient is on local anesthesia, we want to go for surgery, it is must that house officer should write a investigation, like in local in ophthalmology we are using more RBS or viral markers like HBS, HCV, HIV. These are must, and they have to write. Or in the GA case, with that we will he or she will add CBC or chest X-ray also. Or in the also on the next day or on that day, because when we are admitting the patient, again we are making the pre list. The PGR who is doing the examination of the patient should be fully dilated at that time, or also in the next morning if the patient has cataract surgery or any kind of surgery. And what we expect you from you when there's operative day, for example in the OT. So you have to reach to the operating rooms at 7:50 a.m. in the morning when you are changing. So it will take time. At 8 o'clock you have to be present there, and we are taking the picture. After taking the picture, on the morning picture, you have to rush to block area. We have their local anesthetic, and the house officer will combine that to medication for the block, and according to the patient numbers that we have in the list, and they have to make that. Like we have, if we have 10 patient in local anesthesia, we need 10 blocks. So 2.5 cc lignocaine and 2.5 cc bupicaine that are combined in a 5 cc syringe. and that will be later administered, injected by the PGR. And also, when the surgery has been completed by any SR or any seniors or any PGR, the house officer will ensure that post-operative notes, operating notes that has been written and also signed by relevant surgeon who has done the surgery. So this is also one of the responsibility of the house officer. And what we expect from you when you have pre-op, post-operative day. In post-operative day, what we are expecting from you? You have to remove dressing, and also you have to remove iPad and do the dressing of the eye of the patient, and also take the vision of the patient and help the PGR in the examination of the patient. If there is a decision in the round regarding that particular patient, that they have to send the call to that particular any kind of any department for opinion, they have to write the call. And also, if the patient, if the senior advise at the round that the patient should be discharged, this is the responsibility of the house officer, that they have to make the discharge and help the PGR. And also from the PGR, they have to sign and stamp and counter check that this medication for this particular patient is okay or not. And also ensure compliance of topical medication, that sometimes we are advising for the particular patient some medication and we are removing the dressing, and they have to ensure that. But also, more commonly, they are installing by themselves, but sometimes it needs just insisting and guiding of the patient. And also the nurses helping in that. What you should know as a house officer, there are certain skills and knowledge as a house officer you have to know in ophthalmology department if you're working. For example, you have to know how to take the history taking. You have to know visual acuity, use of Snellen chart. Inshallah, you will learn that very soon. And also, you should know how to do a torch examination on the eye. And every house officer, we are recommending for them that they should have one torch with yourself, and how to do the pupil examination and how to explain that. And also slit lamp examination, the very basic instrument in our department, and we are using more commonly, and how to use that. Inshallah, they can learn very soon, because house officer are very in close contact with PGR, and they can learn very soon this slit lamp examination and how to use that. And also, they have to know topical medications, because you know that we are advising for the patient preoperatively or postoperatively topical medication. More patient will come and they will ask from the house officer how to use this, because ophthalmology is a very specialized area and a very specialized field. So most fresh house officer, they will, if they come to our department, they have less information regarding that, and because of that we are arranging this particular session for them. And inshallah, I will later show you to which medication you have to know as a house officer. And also, we have some ocular emergencies. This is most important for the house officer, that they have to know how to manage and diagnose different kind of ocular emergencies. And also, you have to know the post-op dressing, how to do the post-op dressing. Inshallah, we will know that. So history taking, I have a full video on this, how to take a history in ophthalmology. Inshallah, I will share with you the link in this particular video. Below this particular video, you will find that. So the most important thing when the patient come to our department, first is presenting complaint. Presenting complaint means chief complaint, why the patient came to our department. In ophthalmology, that is very specific, and very patient will come that I have decreased vision. When you are checking the vision, patient will have decreased vision. Patient will say, I have diplopia, double vision, I have red eye, or like that different kind of complaint they will have, and you have to know. I have explained history taking in very detail with logical with logics, that is about a 20-minute video. You can follow that very uh, in detail. Just I will explain some of the most important points of that. In history of presenting illness, you have to ask regarding the presenting complaint in very detail. And past ocular history, this is so important for us, because the patient which coming to our department, they have actual problem of eye, and we have to take this history in very detail. We are using one mnemonic in our department. I'm using personally more, and this is very organized. That is called GSTMIL. It means what? This G mean glasses. You have to ask from the patient that you are using any kind of glasses. If yes, how many days, how many weeks, or how many years, for near, for far. Then you have to ask, have you done any kind of surgery, right or left eye? Then you have asked from the patient that you have there was any kind of trauma to the eye. Then any kind of medication you are using or you have used. And then you have to ask from the patient that you have used any kind of injection in the eye, like we are using different kind of injection in our eye, like intravitreal injection, peribulbar injection. Yes, he or she will say that yes, I have done. At the end, you have to ask about laser, that you have done any kind of laser in eye or not. We are using different kind of laser that I have explained in that history taking in very detail. Then in the past medical and surgical history, you have to ask that there are particular disease which has a very close connection with the eye, and eye is the part of our body, so that systemic disease can affect the eye. One of that is diabetes mellitus, hypertension, ischemic heart disease, and asthma. You have to ask from the patient these particular disease, and also the family history, personal history, socioeconomic history, and also drug and allergy. You have to ask from the patient. So this is so important. After that, when you have taken the history, you have to advise the patient investigation in local case, which we have more cases of that. We are advising for the patient RBS, and that should be less than 200 milligram per deciliter. If the patient is diabetic or that is more than that, we have to send the patient to the diabetic clinic, and they have to control their diabetes, then they will come. And also we have to advise viral markers to the patient. If they don't have these two parameters, we cannot shift that particular patient to the operating rooms. Or in the children, we are doing these investigation like viral marker, CBC, and chest X-ray. But we are sometimes we can advise RBS also, but not more commonly. So these are must: viral marker, CBC, and chest X-ray for the general anesthesia. And also house officer will know how to install the eye drop in the eye. It is very easy. Just ask the patient to look to the ceiling and install one drop in the lower fornix, not on the globe. And after that, you have to ask the patient to close his or her eye for 5 minutes. These are some topical medication that we are using most commonly in our department. We have midriasil. You can appreciate here with white with the red head. Midriasil, which is the commercial name. The generic name is tropicamide. We are using this for dilatation in the fundoscopy examination, which has a half-life of about 4 to 6 hours, and it can dilate the pupil within 30 minutes or 20 minutes. When you have installed this, and you have to install in both eyes, not in one eye, because both eyes are important for us. And you have to counsel the patient that they have to wait for 30 minutes. And also the next one at the middle, that is alkane. Alkane we are using as anesthetic to remove any foreign body and to do the IUP of the patient. And also we are using cyclopine as a dilating drops, but most commonly we are using in the children as a for cycloplegic refraction. So these are some topical medication, like we have moxifloxacin with a different name, brand name like Moxigon, Vigamox, and you have to know this. We are advising also as a topical medication postoperatively for the patient. We are using this QID, Predfort, which is the brand name, prednisolone eye drop. We are using postoperatively for the patient 1 hourly. And also Nivanac, we are using postoperatively and preoperatively also. It is NSID, which is diclofenac sodium, Nipafenac. We are using QID. And also fluoromethalon, which is also a kind of steroid we are using in some kind of diseases. And also there is one disease of hypertonic saline. This is what is this? This is a 5% hypertonic saline. We are using more commonly postoperatively to clear the cornea of the patient after cataract surgery. So you have to know regarding this patient, and patient will come to you and they will ask from you how to use this particular medication, and you have to know regarding that. And we are using this oft hypertonic 1 hourly, and sometimes if the patient has very cloudy cornea and very hazy cornea, we are advising 30 after every 30 minutes. And also postoperative dressing, this is optic ipad, and how to apply that and how to remove that. You have to remove from the forehead, then from the cheek. And how to do the postoperative dressing. This is so important skills. The first procedure that I have learned in our department, which has been shown by one of PGR at that time to me. And you have to take there is a we have a wet cotton in our examination room, and you have to start from the medial canthus toward lateral canthus. Okay, first you have to clear the eyelashes, then the eyelids. It is must. These are some ocular emergencies that we have in our department. Sometimes the postgraduate resident that are on call in another department, and you will be at the evening or at night. You will be in the ward, and some patient will come. They will have a very severe pain, redness in the eye, and they will have ocular surface foreign body. And you have to just first take the vision, then you have to instill the alkane and remove under slit lamp. This is the ocular emergencies, and you have to know how to manage that. So this is another kind of emergency, most common. It is corneoscleral tear, and you have to know how to diagnose and how to manage. So we are admitting these patients as an emergency, and the house officer can admit this also as an emergency, and they have to start the medication systemically, intravenous, and also some kind of topical medication to avoid prophylactic antibiotic like Vigamox. They have to advise to the patient. And also they have to send investigation and prepare the patient for the operation. If that is child, we have to do the systemic investigation, which is CBC chest x-ray. So we are preparing these patients for the operation, and we are doing the important investigation for that patient. This is also an emergency, which is the lacrimal system is damaged, and there is lateral canthus tear, and we will do investigation and shift patient to OT. This is the house officer can admit this patient. This is also a globe injury, blunt trauma, and subconjunctival hemorrhage. This is also it can be endophthalmitis, which is the very dreadful or very sight-threatening pathology in the eye. And patient and house officer can admit this patient, and when the senior came, and they will decide regarding what to do next for this patient. We will inject intravitreal injection, antibiotic, or we will do the vitrectomy in that particular this patient. That will be decided by the senior consultant. This is also an emergency which has led edema of the right eye. This may be this is a red eye. In the red eye, we have different differentials. It can be primary closed angle glaucoma, and also it can be any kind of trauma. So you have to take the history, and if there is a primary closed angle glaucoma, you have to admit the patient and consult with PGR or SR, and you have to urgently start the medication because it's also a sight threatening pathology. So our HOD, he has a vision for the HO's 3-month rotation, and when the house officer come to our department, and we have a vision for them. What is the vision? We have a particular curriculum for them. This is a curriculum for the 3-month. There are 3 goals during the rotation of house officer. Number 1, enhancing medical knowledge about eye diseases. Number 2 is clinical skills. Number 3 is professionalism, constituting dressing, communication skill, and patient care. So in this 3 goals that we have for our house officer, first of all, that is enhancing medical knowledge. As a house officer, if you are spending 3 months, you should have this kind of knowledge, and you have to acquire this knowledge. Number 1, you have to know the drugs and how to the most commonly drugs that I have mentioned previously to you. You have to know the names, topical and oral medication we are using in ophthalmology, and when we are using that. And this is the list of that. The next one is there are certain most common diseases you have to know the theory and how to treat that, like blepharitis, stye, Duchenne cystitis, conjunctivitis, ocular allergies, cataract, and sometimes if the SR PGR, he or she is more busy in the OPD, you have to counsel the patient, and also you have to know how to counsel the patient of amblyopia, and how to counsel the patient of strabismus, and how counsel the patient of refractive error. We are using different kind of instrument in ophthalmology. The house officer should know that. One of that is tonometer, which we are using for the IOP checking intraocular pressure of the patient, and also slit lamp, auto-refraction machine. They have to know ophthalmoscope, retinoscope. So these are most important instrument that they have to know. In clinical skills, the house officer, which is the second aim, in 3 months they have to know what. Number 1, level 1, if you are gaining any kind of skills, number 1 is observation. You have to observe that. Directly you could not do. You have to see what they are doing. One of that is various cataract surgery they can observe, like ECC, ICC, trabeculectomy, strabismus surgery, probing, syringing, DCR. They can observe that. And level 2, they can assist some kind of surgeries like evisceration and enucleation. They can assist. In level 3, perform under supervision. There are certain minor surgeries we have in certain diseases like Friday and Monday, and they after observation they can do it, like removal of suture, management of acute congestive glaucoma, and some nerve blocks. And level 4, which is performed independently. They can remove foreign body independently after supervision. When they have learned, when they become independent, they can remove that. In first aid treatment in cases of ocular emergencies. And they can also do the lash epilation. There are certain methods in ophthalmology that we have, and the house officer should acquire that, and they have to learn that how to do. That is visual field, Bell's phenomena, extraocular movements, torch examination, pupil reactions. They have to know. And also in professionalism, this is so important. Our professor Saab, he is saying that we cannot give the whole knowledge regarding ophthalmology in just 3 months, but we can teach them professionalism and how they will use that principle of professionalism everywhere in every department, or all in their life. That is self development. Self development means when you are coming to the duty, your dress should be neat, your attire should be very well. And what I have explained previously to you, that the two values of our department, that is punctuality and honesty, that is so important toward senior, juniors, and nurses and paramedical staff. That is so important. And also in patient care, you have to elicit, record, and present focused histories and eye findings. And also you have to explain to the patient and patient family the prognosis of the diseases. We are also giving a chance to our house officer, and they have a two presentation, one at the start of the year joining, and the second presentation. Every house officer, it is mandatory that they should have a presentation at the end of the year, rotation, and they have to elicit how to present on a presentations. Actually, in this presentation, they are qualifying for an award, which is after 3 months we have best PGR and best house officer award. So they are qualifying for that, and this for this presentation they have to work hard. And based on which criteria we are qualifying, or we are giving mark to the patient. And this is a 360-degree evaluation of the house officer. They are taking information from the OT, from the OPD, from the ward, and also from the PGRs, from seniors. And after that, it is a lot of paperwork. After that, they are they are taking decision that which house officer has good professionalism, every regarding punctuality, regarding respect, regarding patient care. Everything matter in this. So this is a feedback performa on which you will be evaluated during your presentation. Number one is personality. So this has a 10 marks. The lowest mark is 0, and the highest mark is 10. Depend on your attire or appearance on the day of presentation or in the normal day. Also, if you look very professional, so if you have a good attire, so you will take the highest mark, which is 10. In the confidence, if you have a good confidence during presentation, you will take 10. If you have a good energy, so you will take 10. If you have a smile on your mouth, so that you will take 10 from that. The next one is delivery. How you are delivering your presentation. Number one, it depends on your voice quality or clarity. So you have to avoid during your presentations. Your voice should be very clear. So to avoid this, you have to practice before your presentation, and you have to take opinion of senior PGRs, and they will guide you. And also another is SLOs, specific learning outcomes. If you have a good specific learning outcomes, depend on that, you will take 10 marks. And also introduction of your presentation. Ice breaking means that during your presentation, at the start, at the middle, or at the end, you are just awaking your audience, and you will give some joke, some share, everything like that. That is just change their thinking. And also, it's not like this that you should just come in front of the podium and you will just give your presentation. It should be interaction also with the your audience. And also at the end, you will have a message. And this presentation is for 5 minutes, and you should time bound. So if you everything you are presenting, that will be within 5 minutes, and you have to follow this. And also at the end, presentation when you are making the slide construction. If you have a good slide construction, you have not copy paste, or you have made by yourself, you have worked hard for that, you will take 10 marks for that. Pictures which you have taken, it's high quality. And also if you have taken by yourself, we are recommending to you that you have to take, because we have a lot of patient exposure, we have a lot of pathology, you have to take by your own, not download from the net. And also if you have audio or video in your slides, because sometimes if you are adding some video, you can explain a very huge concept in just 30 seconds, and you can explain that very well. And also content, if your content is high quality and that is concise, so you will take 10 marks for that. So based on this, if you have a good performance, mm, uh, that will be divided by poor, satisfactory, good, very good, excellent. So you have to try your best, and you are qualifying for the best house officer award. So this is so important, and you have to know regarding this. But before presenting in the main conference, you should have a very good practice on that, and you have to take the opinion of the senior PGRs, SRs, because at that time when you are presenting, all professors, SRs, PGR are there. So you should have a very good more practice for that. This is every quarter we have a best house officer award. So at the end of your rotation, we have a farewell party for every house officer batch, and also we are giving a house officer award to the best house officers. So that is arranged by our department. So thank you. At the end, for me, life is please, thank you, sorry. What it means, please, thank you, sorry. Please means that, for example, if you need anything in this world, because we are living in a community. So if you need anything, you can just request to someone that please, I need this one. Very politely, you can request. Thank you mean that when someone has given you something, they have helped you, just be thankful from that person. Or we are human community, we are making mistakes. If you make a mistake, don't depend on your mistake. Just say sorry, it was my mistake. So this was my presentation, and I hope you will enjoy. And this will be my last presentation to House Officer of Ophthalmology Department, Nishter Medical University and Hospital. So I hope they will find very fruitful, and this recommendation is so important, not just for our department but all around the world. They can use this guidelines for how to spend their time very efficiently, and how to take them most benefit of their rotation. Thank you. Assalamu alaikum.
My name is Dr. Mohammad Adil Rao, and I'm the house officer of this department, and I'm a foreign graduate.
Hello everyone, my name is Dr. Mohammad Muzammil. I'm a current house officer at Nishter Medical University, and I graduated from Nishter. My session was N68.
Assalamu alaikum. My name is Dr. Muhammad Ahmed Kareem, and I am also a graduate of Nishter from N68.
Assalamu alaikum. I am Dr. Asma Mariam. I am vegetarian, and my session is N68.
Assalamu alaikum. I am Dr. Arij Mujtaba, and I am a vegetarian graduate from batch N68, and I am currently a house officer at Ophthalmology Department.
And this is professionalism, self-development, and patient care. You should have that. We said at the start, it's our mission, which is empathy. When you have joined our department, and we are giving you a chance to present your presentation regarding eye disease, any particular topic. You will come here and you will present. How you will present? Actually, you are qualified for. We have every 3 months, every quarter, best HO and best PG award. Actually, you are qualified for that. So we are giving a chance for you. This is one house officer. He is doing his examination. And in this particular presentation, what you have to know. Okay, the people who you are presenting your presentation, they have all that knowledge. Just they want to know how you're presenting, how you dress, and how you speak, how you communicate. Okay, so I will share that with you, how we are evaluating you. So you have two presentations at the start of your house job and at the end of house job. Okay, then that has a complete 360-degree evaluation, A1 from PGR, from staff. Okay, so be careful what you are saying with your colleagues, with your senior, juniors. According to that, they will rate you. Or everyone can be the best house officer. You have also a chance. You have also a chance. So this is a feedback pro forma on which we are evaluating you. Number one, personality. It has from 0 to 10 marks. Your attire during presentation, your confidence level, your energy level, your smile. If you have, that is best, you will take 10. 10 out of 10. Okay? Your delivery. How you are delivering your presentation. Your voice quality, your clarity. If you have a good voice quality, if you are not doing it's good. You will take 10. Specific learning outcome. If you are giving a 5-minute presentation, you have a very limited time. So you should have a specific learning outcome. Introduction, ice breaking. What's ice breaking? For example, you are giving at the start or at the end of or at the middle of some joke, some videos, just to awake your audience. You should have interaction, just not you will come here, Assalamu alaikum, mera naam ye. No, you should have interaction with your audience, and at the end you should have a home tech message. The patient, you will give a message, and you have a limited time, and you should also manage your time. In presentation, be careful with your presentation. Not me. Achha. This is slide construction. If you have a mid-high quality slide, you will take 10 out of 10. Okay? If you have a good pictures, you have taken your pictures by yourself, your patient, don't download from the any kind source like net. Okay? Because we have patient here, we have everything, instrument. Slide construction, pictures, audio or videos if you are upload, okay, if you have in that particular presentation. You can make by your own video. And that can explain a very 5-minute lecture just in 30 seconds if you have a video. If you are explaining, just, okay, play the video and then speak. And also content, if your content is okay. It's not just you have done everything, but your content is not reliable. So based on this, you are qualified for best house officer